For our quality improvement project, our goal was to implement a strategy for early iron deficiency detection as a means to optimize transfusion practices. The goal of our project is to reduce the number of unnecessary red blood cell transfusions with early detection and treatment of iron deficiency anemia. Our objectives were to review literature on current practices of intravenous iron transfusion. We specifically wanted to inquire of a possible relationship between early iron deficiency detection and the need for blood transfusions. We would like to accomplish our goal by implementing a strategy that allows providers to detect iron deficiency in the setting of anemia. Iron deficiency is characterized by low levels of serum iron, serum ferritin, and high levels of total iron binding capacity. Iron deficiency is a common finding both in and out of the hospital. Treating iron deficiency appropriately has been found to reduce the risk of need for blood transfusions in the inpatient setting. Iron itself can be given in oral and intravenous forms. Oral supplements are more cost effective. However, not every patient can tolerate oral supplementation, especially if they have an underlying gastrointestinal disorder. In these patients, iron infusions are preferred. The most common side effects include infusion reactions and anaphylaxis. Best practice advisories are notifications that appear in the electronic health record when triggered by a certain subset of values configured to meet certain needs. For our electronic medical record specifically, we have BPAs for dosing medications for renal dysfunction and initiating protocols for sepsis. However, at the current time, we do not have such advisories for iron deficiency. The figure below highlights our project design. For further research, we plan to utilize data from the OSUMC patient population to perform a retrospective analysis of transfusions ordered for patients who also exhibited iron deficiency anemia. Ultimately, we would like to determine if these patients may have benefited from iron infusions prior to blood administration. We plan to introduce EMR alerts to notify providers patients that fit certain criteria might benefit from iron infusion versus red blood cell infusions. We plan to complete this project by June of 2026. Following the implementation of an iron deficiency BPA, we plan to reevaluate data from OSU-MC patients to determine if early detection and treatment of iron deficiency reduced overall red blood cell administration. Overall, there are many benefits to early detection of iron deficiency anemia, including the potential to reduce the number of unnecessary red blood cell transfusions. Our next steps include implementation of the BPA and obtaining data to compare transfusion rates before and after BPA implementation. We hope to demonstrate that effective use of iron supplementation in the setting of iron deficiency anemia will reduce red blood cell usage overall. Ultimately, we hope to apply this early detection of iron deficiency strategy to all hospital departments. Future directions would also include projects that explore reduction in red blood cell use in the setting of macrocytic anemia and B12 and folate deficiencies. Thank you.